Hi guys, good morning. This is Dr. Behnam. I'm so sorry, I don't see the camera. Do you see the camera? Give me 1 second. Sorry guys. Oh, here we go. Perfect. Hi guys, good morning. I'm Dr. Behnam. That was Francesca. I hope you guys had a great Labor Day weekend. Welcome to another MA session with Dr. Behnam. Hope you guys are doing great. The entire system looks a little bit different today, so it was a little surprising for all of us. So welcome to another session. The way this works is that I'm going to go through some of the questions and we're going to basically answer them. And if there's, and that's how it works. Give me 1 second. I don't see the questions. So sorry guys, this morning we used a software called Crowdcast and they've changed everything on us this morning.
You click on that where it says 3.
And things look so different as of this morning. Usually the questions pop up in the bottom, but I'm not seeing the questions at all. Oh, here we go.
Here we go. Okay.
Here we go. We found them. Just moving some things around. It's all good. Okay, so I'm going to start basically. This is just going through some of the questions. I'm going to answer them. So, okay, I'm finding a bit challenged to restyle my hair once the product is in. Any tips? So that's a very good question. So the product has aloe in it. So sometimes it could kind of like be a little bit of like a gel-like consistency. And that's why you kind of feel like when it dries, you have kind of gel in your hair. There's really not much tip that I could give you other than the fact that, if you really don't like it, you can wash out the product after 2 hours because it's still going to be as effective. So that's the only thing I could recommend. Sorry, guys, we're having some technical difficulties this morning. I apologize. Okay, here we go. Okay, so what are your thoughts about taking the super capsule with finasteride 5 days a week and the finasteride super capsule 2 days a week? So we technically don't have any recommendations on that. There are some people that just generally do that. I don't think there's anything wrong with it. So if it makes you feel better and you think you're going to see better results, you're more than welcome to do that. Typically, the dutasteride is supposed to do whatever the finasteride does plus more. So, so again, we don't typically recommend it, but if you really want to do it, that's fine with us. I'm currently having neurological dizziness, so I stopped taking all the medications. I stopped taking the oral dox and minocycline and the happy topical. And because of this, now I have a lot of shedding. But I restarted the oral medication and a happy head for 3 weeks now. I want to know how long will it take for the shedding to stop. So typically the shedding basically could take about 6 to 8 weeks basically for it to stop. Most of my entire head is a transplant. Will the implants grow back? Yes, the implants basically should grow back. And usually it takes about 4 to 6 months for the hairs to grow back. If you stop and you go through a shedding phase, again, that usually takes about 6 to 8 weeks for it to grow back. But again, everyone's basically different, so we'll see how it goes. But people do this all the time, so it should work. Okay, so now let's talk about the. So one of the patients said that I'm seeing very good results. I'm very happy about that. Another patient asked, how long should I wait basically for me to see the results? Typically, the results takes about 4 to 6 months. So you literally have to be on the medication for 4 to 6 months for you to start seeing some improvements. Now, with the super capsule, so let's talk about the topical happy head as well as the super capsule. So, what the super capsule is basically a combination of minoxidil, finasteride, and vitamin D. That's one version, and then we have another version which is dutasteride, minoxidil, and vitamin D. The reason why we came up with a super capsule was because we realized that not all patients want to apply the topical medication basically onto their scalp. So the super capsule, it actually makes it easier because you take the pill, you just take the pill and it's easy done. It's three in one, streamlines the entire process. Sorry guys, we're still having some technical difficulties. I'm not sure why.
Nothing.
Can you see me there?
No, it doesn't let me log in. Just click plus icon. Do you see a plus icon?
I'm sorry guys, we usually never have this issue at all. So I'm not sure exactly what's going on here. The system changed this morning on us. Can you guys hear me though?
Do that new stage.
Here we go. Okay, sorry about that. Okay, now we're back. Sorry about that. So again, so there are different type of medication that Happy Head has. Happy Head, we have the topical medication, and that was the first medication we came up with. It's a combination of topical minoxidil with finasteride, and we have another version that's basically topical minoxidil with dutasteride. The reason why we came with the topical initially was because orally some patients could have some sexual side effects. Uh, Later on, we came up with a super capsule, which is a combination of three pills all in one. It's a minoxidil, finasteride, and vitamin D all together, or minoxidil, dutasteride, and vitamin D together. Then we also now introduced the female super capsule, which is a combination of minoxidil, and we added some testosterone blocker, which is spironolactone to it, just a low dose along with the vitamin D. And there are some patients that actually um, will do both the topical and oral together. So one of the patients asked, "Hey doc, is the super capsule the most potent of the medication you provide?" Um, Oh, someone said yes, we do hear you. So, yes, it is probably the strongest actually hair loss medication there is in the entire U.S. market, and the reason is because we took the minoxidil, which is a powerful vasodilator that increases blood flow to the scalp. We combined with finasteride or dutasteride, and we added vitamin D. So it's literally taking three pills all in one, streamlines the process. You just take one tablet and just move on. Now, if you do want to make that even a little bit stronger, what I would recommend is that you could also apply the topical happy head to the regimen, which means that so there are people that do the pill and also do the topical at the same time. And that we have seen that by doing what's called sandwiching, doing topical and oral, patients really do see amazing results. What's the questions? Hey doc, fall is coming. What about wearing caps, skull hats? Um, So there's no problem. You could wear hats as long as it's not too tight. There's no problem with it. Typically, patients do lose more hair in the fall, and that's normal. But wearing a hair covering basically does not affect the hair loss at all. Um, so that is not a problem. With respect, or somebody else also asked, what is the difference between the dutasteride and finasteride? The difference is that finasteride is a 5-alpha reductase 1 inhibitor, which means that it inhibits one of the enzymes that's responsible for turning testosterone to DHT. Dutasteride inhibits two of those enzymes, whereas finasteride is only inhibiting one. So technically, and in clinical studies, it has been shown that dutasteride does a much better job at preventing hair loss and causing more regrowth. The only thing is that finasteride is FDA approved for hair loss, whereas dutasteride is FDA approved medication but used off label. So we start like a lot of patients on finasteride first and see how they do. If we see you doing finasteride for like 6 or 7 months and you're still not seeing the improvements, then we switch patients over to the dutasteride. Our topicals, we have two versions of topicals, finasteride and dutasteride, and also we have two versions of our oral, which is finasteride and dutasteride. What are your thoughts on using a topical mixture of finasteride and dutasteride? So we do have that. Um, there's a formula that has topical minoxidil, finasteride, and dutasteride all combined together. It's called the kitchen sink formula. And look, patients do say, that it really does help them quite a bit. Basically, what you're doing, you really is over redundant because the dutasteride already inhibits the same enzyme that finasteride does. But that being said, still patients do say that they do get better results when you use the product that has finasteride and dutasteride together. Very good question. So, okay, so what are different forms of alopecia and how does basically happy head help? So there are many different versions of alopecia. The most common one is androgenic alopecia, which is male or female pattern hair loss. And happy head is actually indicated for the male and female pattern hair loss. There's also other forms such as scarring hair loss, known as cicatricial alopecia. There's also alopecia areata, which is an autoimmune condition. Happy head is not really indicated for those conditions. Not that patients haven't used them in the past, but we don't go around basically saying, oh yeah, if you have alopecia areata, please use happy head. But that being said, we have had patients who use the topical medication for alopecia areata along with a dermal roller, and basically they've told us it has helped quite a bit. But technically, the happy head products are mainly used for male and female pattern hair loss. What is the best time to see a dermatologist if I think I'm experiencing hair loss at a higher rate than normal? Is there age where men and women start to see hair loss? So there's really no basically age. I mean, look, I have patients that are in their 40s and they're barely seeing hair loss. I have patients that are 16 years old and already seeing hair loss. So it's really a wide range. A patient could see a hair loss depending upon their stress level, what they do, their family history, genetics, and who's bald in the family. Our recommendation is that the sooner you get to see a dermatologist for hair loss, the the better it's going to be. The reason is because hairs go through a different stage of miniaturization. Some hairs are very thick and then they slowly thin out. It's called miniaturization. So, if you wait for the hairs to have really miniaturized a lot, then basically they go past the point of what's no return. Then that hair is dead and there's nothing you can do about it. So the earlier you start addressing the hair loss question, the hair loss situation, the better you're gonna be. Because let's say if I look at someone and you can look through the scalp and you could see they're thinning, but they're not completely bald. That is the best time to start the topical happy hand medication, the oral happy hand medications, because the hairs have miniaturized but not completely dead. But if you wait and face someone is already bald or balding, then that's just way too late. And unfortunately, sometimes if you lost a lot of hair, they need to do a transplant. What happens to our hair as we approach cooler temperature? Does it make your hair fall out more? That's a good question. That's actually not true. So the cooler temperature really does not affect basically your hair quality or the miniaturization. A lot of that is determined by just genetics. Now that being said, we do know that during the fall months, a lot of people do have a lot of hair shedding, and we still don't understand exactly why that is. But typically, cool temperature does not affect your hair loss. So I'm looking at the question that Francesca has right here. How do I protect my hair follicles in the regrowth while using Happy Head products? Okay, so basically, as you know, what the Happy Head products do is that they reverse that miniaturization stage. So, for example, let's say if you're thinning a lot, by using the minoxidil finasteride combination, the minoxidil increases the blood flow to the scalp, and finasteride is a DHT blocker. And by doing that, basically, you reverse miniaturization, and your thin hair basically gets thicker. So the most important thing is as you're doing this step, if, for example, let's say if you're having some irritation from the topical, I want you to use some moisturizer on the scalp, also just use some leave-in conditioners all those basically help you basically protect your hair, and also more importantly, like don't pull on your hair, really, I mean, that's don't pull on your hair, don't use very hot blow drying basically levels, because all those could damage your hair as well.
Maybe you can talk about some of the new products.
Yes. So guys, so let's talk about some of the new products that are coming out. Here I have some patients ask some questions. Let me address them first. Uh, I'm nervous. I sweat at the topical minoxidil since I sweat a lot. Should I take the oral and topical minoxidil to guarantee maximum effectiveness? Look, everyone's going to sweat. First of all, you have to realize that the first 2 hours are the most important thing. So let's say you're putting it on, and after a couple hours you go and play exercise and play sports or exercise and you're sweating. That's technically okay. The only problem with sweating is that if you get a minoxidil on the face, sometimes you could have a little more regrowth based on the face. Now, to get the maximum effectiveness, yes, doing the oral and topical will give you your best results. Should I use shampoo every day or every other day? We typically would recommend using shampoo every other day. Is there an effect of hair loss or not connected? And what about comb or brush on your hair? So let's talk about the comb and brushing. You don't want to comb or brush too aggressively. Uh, with respect to shampoo, look, the shampoos are important. I don't think they're going to make it or break it with respect to your hair, but they definitely do help. Again, don't shampoo every day. You can wash your hair every day, get in a shower and wash the hair, but we typically shampooing basically every other day. Once your hair grows back, can we stop using topical and just use the super capsule and vice versa? That's a great question. Everyone's different. So let's say you're using the topical and oral together for 6 to 8 months and the hair grows back. It is possible that you could stop the topical and just be on the oral and you may do great. But it's also possible that if you stop one, all of a sudden you start to see shedding again. So everyone's different. You kind of have to try it for yourself and to see how your body responds. But that being said, a lot of people have done it either way and they've done, and there's no right or wrong answer. Hey doc, should I use the super capsule in conjunction with topical or no need to do both? That's a great question. Well, uh, clinically, what we see in our office is that, and from our patients, when you do both together, you tend to get better results. I mean, that's just the truth. When you do topical and oral, you're going to see better improvement. Now, do you need to do both? No, not necessarily. But if you do, that would be great. Also, I don't recommend using both simultaneously at the same time. So my recommendation is basically start with one and do it for like about a month, and then introduce the other one. So then this way you minimize the side effects. If I plan to try to get pregnant in the next 6 months, is it okay if I'm still using spironolactone for now? Yes, but I want you to stop 3 months before you try to get pregnant. 3 months before. Will reducing the finasteride concentration to address side effects trigger shedding? Typically, it shouldn't. No, typically not. Um, Usually, it's when adding the topical minoxidil or minoxidil that could basically initiate shedding. When you first start using Happy Head, will you experience shedding? Well, great question. Yes, maybe. Not everyone. The topical minoxidil, which is available in over-the-counter known as Rogaine, could cause an initial hair shedding. It even happens with the over-the-counter one, so it's nothing special just to us. Minoxidil could cause an initial hair shedding. Now, patients that go through initial hair shedding actually end up with much better results, and the reason is because it's just resetting your hair cycles, and those patients end up with better results. And typically, it takes about 6 to 8 weeks to pass that initial hair shedding. The hair shedding could happen with the topical and oral minoxidil. It's more likely with the topical than the oral, just FYI. Great. Here, guys, I'm just going through the questions to see if there's any other questions. Should my topical mimic my oral? For example, if I have a minoxidil finasteride topical, should I have the same formula in the oral? Not necessarily. I mean, it shouldn't. So, for example, we have some patients that are taking the minoxidil finasteride topically, and then they go on the minoxidil dutasteride orally. So it doesn't need to basically mimic what you're taking. In fact, I prefer that if it doesn't mimic it because I think you're going to have just better coverage and patients might see even better results. That's a very good question. Guys, I love all these questions. This is great. We're just waiting for more questions to come in. Okay, let's talk about some of the new products. Okay, here one more. Okay, hey doc, I'm using topical for 7 months, but now it seems I've hit a plateau. I filled in nicely, but I need a bend more in the frontal region. Should I use a super capsule? Yes. I will continue the topical and I will add super capsule, see if you can fill in the front more. Um, Also, it all depends how much density you have in the front. I mean, if you have not a lot of density in the front, then it is just not going to grow back. But if I were, I would add the super capsule and see how you do. Does dermal rolling help if I'm taking only oral? Yes, it does. So you could take the oral medication and you could still at night basically dermal roll. And my recommendation of dermal roller is a 0.25 or the 0.5 dermal roller. And also don't be very aggressive. Don't make your scalp bleed. The pressure you want to apply is the same pressure that you do like you apply deodorant stick. So very light pressure. Do you have a dermal roller here? Or no, we don't. I'm gonna demonstrate it.
We don't.
We
Next
usually,
time.
next time. We usually do though. And then also if you are already using the topical medication, so when you add the topical twice a day, our recommendation is when you add it at night, the dermal roller and basically dermal roll basically back and forth. And also I know some people try to say, well, I read online that you should use the 0.5 dermal roller or the 1.5 dermal roller. The one I recommend is the 0.25 dermal roller.
I think now's a good time to talk about upcoming products like the derma roller.
Okay, yes. So let's talk about the derma roller. So guys, we're coming out with our super duper amazingly great derma roller. It's a 0.25 derma roller, and it's really nice and really elegant. The spikes are really like high end. So you can get that on our website. We also have our also we came up with the Lattice formula, right? Did we come up with this? So we also came with Lattice. Lattice is the eyelash grower that you can apply basically to our eyelashes. That's also currently available on our website. As you guys know, we have already come up with our female super capsule formula. But the female super capsule is a combination of oral minoxidil combined with oral spironolactone along with vitamin D. So the minoxidil, the vasodilator, increases blood flow to the scalp. Spironolactone is a testosterone blocker. So and vitamin D, I think everyone is a vitamin D. So by having all these three combined together, it really helps. Basically, it helps to basically cause a lot of hair growth because not only you're increasing blood flow, but you're blocking also testosterone as well. It's kind of like a combination of multiple different things. We're trying to address multiple different causes of hair loss from in just one tablet. Why only the 0.25 millimeter depth for the dermal roller? How does it work on these follicles that aren't active? So, so I believe that even with the bigger, the deeper needles, you could actually damage your hair. And I've actually seen patients basically have scarring from the dermal roller because they were just so aggressive with it. And the 0.25 penetrates enough that allows you to decrease puncture holes that allows you when you apply the topical basically penetrates deep in there. And it does help basically to revive some of those hair follicles that have been dormant. So I don't think you need anything stronger than that, and it's also the safer way to go. So I would stick with the 0.25. Again, I know a lot of places on the internet they talk about the 1.5 millimeter depth. I think those are very painful, and those are just way too much. So I don't recommend. I don't like to recommend those. But that's a great question.
A question we've been getting a lot, Dr. Ben, from some customers is, will Happy Eye help if I've had a hair transplant?
Oh, great question. So when you have a hair transplant, you have to realize that not of all those transplant hairs are going to grow out. So with happy eyes, we have a lot of patients that after we do hair transplants or done the hair transplant other places, basically we give them the happy eye formula and they apply to the scalp, and the new transplant hairs grow faster and better. I mean, as simple as that. And also, again, there's not all transplant hairs grow out. When you do the happy eye products, either topical or oral, it will help some of those dormant ones or lazy hairs basically from growing out, and you will get better results. Hey doc, what about using hair gels or dye coloring hair for those gray hairs? Are they connected with hair loss? That's a great question. So the hair gels are not directly related to hair loss. I mean, I do believe that there are a lot of chemicals in them, and the more chemicals you put basically on your hair, the worse it is. The hair coloring for men are actually safer compared to the other ones that may highlight your hair. So the two colorings, so you could go either darker or lighter. So if you go lighter, you have to use a hair color, and then you have to use bleach, and those will really damage your hair. So I always recommend don't use lighter, like don't use hair colors that's gonna go lighter. Don't go blonde. I mean, sadly, those are not good. Going darker, that means using the hair coloring for gray hair, is acceptable. As long as you're not doing it every day, you should be fine. Again, I will find some that are like ammonium free and are not too harsh on your hair. Hey, Dr. B, my four previous bottles of minoxidil was in the yellow color, but I received a new bottle and the solution is absolutely transparent. Why is that? Great question. So typically, the yellow color of the product has to do a lot with the retinoic acid. So and also during shipment, some of the retinoic acid basically precipitates out of the solution, so it makes it a little bit yellowish color. We have noticed that we've done some studies that the concentration of the retinoic acid really doesn't matter. So, but if you increase the retinoic acid concentration, you get more irritation. So we have slowly reduced some of the retinoic acid concentration. It's still in there, but it's slightly less. So to reduce some of the irritation that some of the patients have been experiencing, but it's still there. And clinically, it should not make a difference at all. So that's why some of the coloring is a little bit different. Also, if let's say if you have a bottle at home and you leave the bottle in for a long time, just outside, it does turn a little more yellow color. So a lot of things also has to do with shipping, the weather outside. So a lot of those do affect the product as well.
Does it affect the potency
It
though?
does not. It does not affect the potency at all. It's the same potent formula. As we approach the fall season, does the hair need to be cared for differently? Will I use more hair during fall? So typically, and that's a very good question. Typically, patients do lose more hair during the fall, and we don't really know the reason for it. I don't think you need to take care of it differently, but you could be more diligent about applying the topical onto the product, or taking more of the oil more consistently, so that you just kind of preemptively basically have just more hair growth.
We weren't able to put the disclaimer if you
Oh
want
yes.
to say.
Okay, guys, let's talk about disclaimer. So just a quick reminder that basically all of this is for educational purposes only. None of this establishes a patient-doctor relationship. And if there's any questions, please talk to your doctor basically about any of the questions that you have.
And then lastly,
Okay, also, if you're new to Happy Head, you could use my coupon code as Dr. Ben60 to get 60% off. And again, if there are any questions, please feel free to reach out to our help desk, help@happyhead.com. And again, we always encourage our patients to get online and register for us on Facebook or Trustpilot. We really appreciate it. Thank you so much. Well, guys, I think we're done with today's session. Sorry about all the technical difficulties we had this morning. Apologize. We're gonna be here in a few weeks. We're gonna be here in a few weeks, and we'll have another AMA session. Thank you so much, guys. Have a beautiful day. Bye.